If you want to know what's going on in Rockingham County government, check out Rockingham County 411. If you're interested in county governmental programs, projects, and services, don't miss Rockingham County 411. Public Information Officer Mabel Scott will share important, crucial news you can use with Rockingham County 411.
Rockingham County 411, you're in a good place, and we're talking with our interim public health director, Susan Young. Give us an update. Today is September 4th, 2020.
So we will just talk about what is going on with our cases right now. So we still have some outbreaks going on at our long-term care facilities, the two long-term care facilities that we have been dealing with, the Bryan Center in Eden and Jacobs Creek in the Madison-Mandan area. And we are still having some cases from those facilities through staff and residents. And we're also seeing community spread basically in the community everywhere, and we are having a harder time tracing exactly where these people are getting the virus from.
So when you say everywhere, that means that?
It's it's in Eden, Reidsville, Madison-Mandan, Stoneville, Stokesdale.
Throughout Rockingham
It is
County.
throughout Rockingham County. There's not a corner of Rockingham County that has not been touched by some COVID infections.
As far as the number of cases, those recovered, at home recovering, our hospitalizations, how's it looking?
Well, currently we have 911 confirmed cases since it began, and there are 491 recovered cases. 211 are at home recovering. We have 24 that are still hospitalized, and unfortunately we have 18 deaths, Mabel.
Yes, and our prayers and thoughts are with those families. Long-term care facilities.
We can, like I said, we continue to see cases there, and we're continuing to work with those facilities. They have both facilities have transferred some of the positive residents to other places within the state, their sister agencies and sister facilities, to try to kind of ease the burden on them here and with their staff shortages. So they are doing everything they know to do to possibly help the residents there and also help with the staffing.
The governor's new move into phase 2.5.
So starting today at 5 o'clock, September 4th at 5 o'clock, we will go into phase 2.5. And basically the nuances of this is that mass gatherings limits will be increased to 25 people indoors and 50 people outdoors. The kids' playgrounds will get to reopen, and I'm sure they will get to enjoy those. Museums and aquariums can open at 50% capacity. Fitness and competitive physical activities can resume at 30% capacity. And all employers are strongly encouraged to provide face coverage for their employees. That is still the safest and best way to prevent the spread of this disease. Wear your mask.
Wear your mask.
Yes.
Wear your mask. The 3 W's: wear, wash, wait. College students coming back home.
Well, the governor recommended, if it was possible, for the college students to stay there on campus. I know a lot of dorms have closed down. If the kids were in a dorm, they were forced to come home. So when they came home, they should have segregated themselves in the house, used a separate bathroom as possible, stayed away from the family for 14 days just to make sure that they weren't going to be infected or present any symptoms. And a lot of kids that lived off campus, apartment housing and things like that did stay, and that was recommended if they could, just to stay in that area.
What are your contact tracers now finding?
They are basically finding what we knew all along. There's more community spread. It's generally just out in the community, and people are still going to gatherings. They're going to social gatherings. They're having gatherings at their home, and this is real important over the holiday weekend. This is our last kind of hoorah for the summer. So I know everybody wants to get together, cook those hamburgers and hot dogs, go, and it is predicted that 60% of people in North Carolina will be traveling to a beach, to the mountains, hiking, camping, doing all these activities. So just be very aware of prevention when you're out doing these activities. Wear the mask, stay socially isolated if you can, and just do the preventive measures.
What are the kinds of things that really concern you most?
I think what concerns me most is people really truthfully not wanting to wear a mask. There seems to be a just big disinterest in wearing the mask, but it is the only thing that we have. We don't have a vaccine currently. We don't have any medications currently. We don't have any pill that you can take to prevent you from catching this. Basically, all you can do, and it's been proven to work, is wear your mask, socially distance, stay that 6 feet away from people, and just wash your hands. And that is what we can do to help each other, help the long-term care facilities, and just help get our cases back down. Everybody wants their kids to go back to school, and we want to be able to do these activities, but we all just have to do our part, Mabel.
And we're all in this together. We are all family together. We want to keep as many people healthy as possible. And the one thing that we can all do is simply wear this mask. It's real simple. Just wear this mask and do what our experts and the scientists and our nurses and doctors have asked us to do. Wear your mask and get a couple of masks for other people in your family, and just let people know who you really care a lot about and who you love. And those who you work with or you come around and you see, just ask them, wear a mask. It's because I love you. Wear your mask. Let's do what Susan Young has asked us to do, and let's stay healthy. Rockingham County 411, you're in a good place. So wear your mask.